Dr. Kevin Cavanaugh is a retired ENT from Somerset, Kentucky. He founded an organization called Health Watch USA. Kevin, good morning.
Oh, good morning, sir.
You have seen probably Kevin's editorials in the Herald Leader and the Courier Journal and lots of other places. Why? How many years did you practice?
Oh, goodness, long time. At least 20.
20 years.
Yeah.
And then you retired and started this organization, Health Watch USA. Why?
Well, very, very concerned about healthcare transparency. In other words, getting patients knowledge about the quality of care and trying to improve the health care that patients get.
And you also became a patient.
Oh, yeah. Well, that was the big reason on why retiring. I've got pretty severe arthritis, and that's not compatible with being a microsurgeon.
And I understand the doctors are the worst patients in the world. You don't deny that, do you?
No, I won't deny that at all. Yeah.
But I really appreciate the, I guess, even-handedness, I think, of you and your organization. I don't think you're out to get anybody, but you're just kind of wanting people to understand what's going on out there.
Well, and that's true. I mean, I've seen it from both sides, both being a doctor and being a patient, and depends upon which hat you wear. Every side, has two arguments, and seldom is one side completely right or the other side completely wrong. And Health Watch USA, really does have a large group of people. I mean, even though I started it many years ago, we have many very talented people. Dr. Daniel Simon, who's currently up in Duluth, who's our epidemiologist. We have a number of PhDs who work with us and generate a lot of policy and position papers. And so when you talk about Health Watch USA, that's not just me. I'm a pretty small part of it at this point.
Now, you do have an event that's coming up this Friday. Tell us about that.
Yeah, that's correct. It's November 7th, this Friday. It's an all-day event. I think the public will be very interested in this. It's going to talk about in the morning a full disclosure, and that means, telling patients if a medical error occurred or something went wrong in their care. And in the afternoon, we're going to talk about dangerous infections, such as healthcare-associated infections, and the new regulation which has been filed by the Governor Beshears to try to increase reporting and increase health department engagement. And Dr. Humbuff from the State Health Department will be presenting that.
Where is it, first of all?
It's at the Four Points Sheraton. It starts at 8:30. There is a cost of $50, but that does include lunch and snacks.
Okay.
And it's a nonprofit. You can go to healthconference.org for more information.
Okay. I asked you to come here today to talk about Ebola. We've heard everything that we can hear about the election, and most of us are ready to scream the next time we hear a political ad. So it's too late now to be speculating about the election. This is election day, and lots of people are concerned about Ebola. But I want to talk about, again, going back to my premise that you're even-handed and will give us the straight deal. I heard yesterday that your likelihood of dying is greater from your pajamas being set on fire than from Ebola, which was probably kind of a tongue-in-cheek kind of thing. But the reality is we got a serious problem in West Africa, serious problem. But we don't have a serious problem in this country.
Well, and that's correct. And it is probably very unlikely that we will get a serious problem. It has to do with the nature of the disease. It's mainly infectious towards the end of life and at death. And the virus itself doesn't live long in the environment, so it is hard early on in the disease to spread from person to person. And if the person is not even symptomatic, the chances are infinitesimally small that they will be infectious or able to spread the disease. Now, may not be completely eliminated, but so small you probably should worry more about walking across the street and get hit by a car.
Right.
And that is something that people need to worry about. And for example, the first case of Ebola that came over from Africa that went into the Dallas hospital, was sent home. And for 2 days, he lived with his family, went around town. He was symptomatic. People were living in his same building. I saw pictures of healthcare workers coming out of his apartment, in fact, without even any protective gear on, which is, of course, is a huge mistake, yes. But no one got infected. And that shows that it's not that infectious early on. Now, when I say not that infectious, doesn't mean you can't get it. Maybe one chance in 2,000, who knows what the chances are, but it's more chances than I'd want to take, obviously.
Sure, absolutely.
But the main danger is towards the end of life. The virus infects almost every cell in the body. Towards the end of life, it essentially fills the cells up with viruses. The cell membranes break. It is a very horrific way of passing on, unfortunately, and at that point, the body almost turns into a bag of viruses, and that's kind of the description from a book that is called The Hot Zone, which was written several decades ago about hemorrhagic fever and Ebola. And at that point, that is when the person is extremely infectious, and that's when you see healthcare workers get it, and when you see also the people who bury the body get it. And that's the main problem in Africa, is you've got dead bodies laying around in the streets. It's just a horrific situation, and that's unlikely to duplicate here. The one concern that's not talked about much, which I think is the biggest danger, and that's if Ebola ever gets in an animal host in the U.S. and becomes endemic, such as what's in Africa. They're not really sure what the animal host is. It might be a fruit bat. That's what they think it is. There may be others. I've read pigs. Some people think dogs. Who knows? And that's what's the danger is it's not totally known. Not everything is known. And if you got it in an animal host where the animal wasn't made sick, it just carried the virus, then you continue to have outbreaks. And that would put a huge strain on our healthcare system.
So it sounds to me like it's not something we ignore, but it's also not something that we push the panic button over. We just stay aware.
Yeah, and that's I think that's the best way of looking at it, because if someone comes over here and they've been a healthcare worker, the chances of them being infected without being number one, chances of them being infected are small, but the chances of them being infectious, in other words, able to spread the virus when they're not symptomatic, is infinitesimally small. And there is a tremendous amount of paranoia. I think the prime example was what was mentioned in the news report that preceded this talk about the teacher in Louisville. She was in Kenya. That's 3,000 miles away. Africa's huge, and yet 21 days. It's crazy. She's not only asymptomatic, she didn't have any exposure. And you're seeing that. The nurse up in Maine, she had a pizza delivered from the moose shack. And when you're in Maine, that's not bluegrass, it's moose.
Yeah.
But at any rate, and I have a friend who lives up in Maine. She's on our board of directors of Health Watch, and she's telling me that people were reluctant to now go to even that restaurant because they had someone deliver a pizza to an asymptomatic person. Now, that being said, if I was a healthcare worker coming back from Africa, I would probably quarantine myself for 21 days, and I don't know whether that's because I'm scared of spreading the virus or just scared of the paranoia of the people that they would, come after me, because there is a huge fear, and I think healthcare workers need to be sensitive to that. That's not saying there's scientific evidence, but there is fear in the general public. Believe me, there are many, many more infectious agents in the U.S. that are very dangerous that we should be scared of, other than Ebola, and should be spending just as much attention to.
Okay, and we're going to get into those when we come back. Going into the break, we have open phone lines, so apparently Ebola is no longer on the minds of our citizens. We've moved on, and that, unfortunately, is the way we Americans do. We get alarmed about something that a lot of times I blame the media for overhyping, and then we get bored with it very quickly and move on to whatever is next, which I think can be dangerous. But anyway, back to Ebola. Is it your opinion, Earl Pitts, as we were laughing about going into the top of the hour, was saying, why would you send Army troops to go fight a disease? How about sending something like doctors if we're going to send somebody? Was it smart, in your opinion, politically or otherwise, to send a bunch of troops down there, and what can they do?
Well, I think it's absolutely the correct thing.
You do?
Yeah.
Because you're a doctor and you don't want to send doctors.
Well, it's not me going. I'm retired.
Right.
But, Ebola is a level 4 pathogen. It is really a hazmat type of a situation. And the Army is very much trained and has proper equipment for taking care of high-level, both chemical, bacterial agents. This is something that really goes beyond medical training. I was asked in an interview, I think it was for USA Today, if the nurses had the same training as the doctors for taking care of Ebola patients, and I said, yes, they've had the exact same training, next to none.
Yeah, really?
Yes, I mean, the new CDC guidelines, they not only require highly specialized equipment, but to just get that equipment on and off, the CDC now outlines not only 2 people, there's one with the equipment, one with the observer, they ideally a separate room, and there's 21 to 24 steps, and it takes some training and practice. So this is actually a hazmat type of operation.
I've heard it said it's easier to put on a spacesuit.
Yes.
Yeah.
I mean, and the doctors are, number one, not trained. Number two, the biggest problem in Africa, yes, there are patients that need to be taken care of by doctors, but we're talking about there are many, again, dead bodies laying in the streets.
What kind of risk are we running sending people down there that are going to eventually come back here?
Well, I think that if they follow proper protocols, you mitigate the risk. One of the things that was said is that they are going to go through a 21-day quarantine period when they come back, and whether or not that is needed or not needed, I'll let the experts debate that. However, the danger is, if you don't fight that over here, and it's not to me so much that now and then we get a patient comes over here, because we can handle that, but if that disease has become endemic, or to get an animal host in the U.S., then we are totally, we're screwed.
So we are protecting our own interests.
Yeah. I mean, it's much better to do it over there. And it's the same idea of it's better to fight terrorism overseas than on home. And,
Gotcha.
And you need to, understand that it will not take many Ebola patients to really put a huge strain on the system, because unlike when you initially heard, well, any hospital that can do isolation can take care of Ebola patients. No, that's not true.
All right, let's take some calls here. Ed, good morning.
Good morning. Can I ask 2 quick questions?
Sure.
Yeah.
One is the doctor was talking about an animal host, and a couple of years ago, the deer herd in West Tennessee had a hemorrhagic fever called blue tongue that was devastated the deer herd, and I just wondered if that's anything that could ever be transmitted to the public. And second question is, if you've got a lady, even though she's in Kenya, but she's going through the African airports, isn't it wise to have her quarantined? Thanks, and I'll hang up.
Well, yes, first of all, a whole ton of people go through African airports, or even go through, airports in Europe. Usually they would go from Kenya to Europe. And so the chances of her being infected is infinitesimally small, number one. And even if she was, which she wasn't, she would not be able to spread the virus until you became symptomatic. And that's, to me, if you start quarantining, you're not going to have enough homes in America to quarantine people. I mean, that's going to be not something I think should be done. Now, as far as the animal host with the virus, many of these viruses are very much animal specific. If and that's just one of the characteristics of a virus. In other words, it may kill a person, but it won't kill an animal. Likewise, with animals, it may kill an animal, but won't kill a person, or won't even infect a person. And so I would think that if that virus was a danger to humans, we would have had some cases and have known about it. So probably not.
If you're on hold, stay there. We'll be right with you when we get back from this fairly short break. Dr. Kevin Cavanaugh is my guest this morning. We're talking about Ebola, and we've got some folks who've been holding for a while. Sarge, thanks for your patience this morning.
Yes, I've got a comment and a question. Dr. Michael Savage is on your station in the afternoon, which I love that show, He is a Berkeley University PhD in epidemiology, and according to the statements he's made about Ebola, he would disagree with your analysis of that situation except for the part about a level 4 hazmat creature. Now, my question for you is, did you know that the roommate of Nurse Hickox was treated for an Ebola infection recently, and the CDC claims they don't know where she got it from? Apparently, they don't know how this thing spreads, and I believe that the journal Kentucky has stated that it's probably got an insidious carrier state.
Well, I'm not, aware that the roommate of the nurse got an infection of Ebola. I don't
Well,
think that's
it's in the Daily Mail. The United Kingdom newspapers cover this stuff a lot better than the government media complex in America. If you listen to Savage, you might learn something. I'd appreciate it if you would. Thank you.
Okay.
Well, thank you very much.
Dr. Savage is the expert now. This is Mary Ann. Good morning.
Good morning, Jack.
Good morning.
I think that the main nurse's roommate had symptoms, but I don't know that she was actually diagnosed with Ebola.
Okay.
But my question is, how did the two nurses in Texas get the disease? When someone comes into the ER, there are normal protective measures taken to avoid body fluids with the patient.
Well,
So how were those two infected?
all right, well, the two nurses, my understanding is, were taking care of the patient in the ICU.
Right.
Of course, what exactly went on in Texas depends upon who you talk to and who you listen to. The stories tend to, change or be clarified or whatever as you go forward. But the proper types of equipment, the proper precaution, is really kind of in the eyes of the beholder. One of the big things that the NNU, which is the National Nurses United, and it is a labor union, but they also do things with patient safety, is stating is that they need to have standards, that a checklist is not a standard, and that is one of the problems. Even though you may think that proper, that proper protocols are being followed, there really is a choice of what is to be done. A lot of things are discretionary, and because of that, control of major infectious disease in the United States may not be as well controlled as in some other countries. And that's been one of our group's main themes, is that we've seen the MRSA epidemic, the C. difficile epidemic, and a variety of other dangerous pathogens,
By which
spin out of control.
likelihood of death from those is much greater in the United States than Ebola.
Much greater than Ebola, yes.
But if you're taking protective measures to avoid contact with HIV and you have the right barriers on, how is Ebola transmitted to those nurses? That's what my question is, because they weren't the only two caring for this patient.
Well, again, you would have to know exactly what type of protective equipment they had.
Didn't they say that also protocol was not followed?
Well, that's what the CDC, had kind of hypothesized, but, again, it gets in what's the proper protocol. The protocols have been changed repeatedly. I mean, you have to have every inch of your body covered. And I'll be honest with you, when I heard hospitals say, well, we can take care of this, we're following, protocols for infectious agents all the time, it was really a lack of, I think, understanding. The governor had a very good grasp of it when he was on here, that every square inch of the body needs to be covered. And you need to have a respiratory, what's called an N95 respiratory mask on. You need to have booties on. You need to have someone observing you take this on and off, because it becomes highly infectious later in life. Now, you hear that Ebola is not airborne, and that's true. But when they say airborne, they mean it's like, it's not, like pollen or like a dandelion seed that floats around the air. It's like a rock. It's on the ground. But it doesn't mean you can't pick up the rock and throw it at someone. And towards the end of the life, The patients have projectile vomiting. They're having fluids coming out both ends. It is an absolute mess, and all of it is just filled with viruses. And they're also in a very closed area. And so if you're not dressed in almost a spacesuit at that point, you're at extreme risk of getting an infection. And that's why hospitals, around the nation are not up to that a standard, and nor would they be expected to be. This is, as I said before, more of a hazmat type of a situation, and now we have several hospitals that are, I think there are 5 areas now that are designated to take care of Ebola patients. And so initially, when everybody was thinking, well, anybody can do this, that's probably not the case. When you get towards death, if this virus becomes so prevalent, it spreads easily. That's the time of spread. And that's my understanding when it was spread. I don't believe anybody in the ER of either visit has come down with Ebola.
I haven't read that either.
Yeah, and nor in the community. And so again, early on in the disease, it's not as infectious. And nor, despite what the other caller said, I have not read or been aware of any roommates coming down. And you can have Ebola-like symptoms, and that's it can be as simple as a common cold or flu. I mean, fever, cough, diarrhea, malaise, malaise means just feeling bad,
Right.
muscle aches. Those are symptoms. I mean, if I was in back from Africa over the weekend, I'm sure I'd be in a hazmat unit right now because I was at that point had those symptoms. So as I said, if Ebola becomes endemic in the U.S., then we're in trouble because it's not easy to separate out people that have the flu,
That have the virus or a different virus.
But we're not in that situation yet. That's why it's so important to stop it over there. But the NNU is very concerned. And to tell you the thing that impressed me the most was that on Friday, it was a week ago from Friday, there was a congressional hearing on Ebola, and this was in the House, which is controlled by Republicans, that, as you know, are very right-wing. There are a lot of Tea Party members, and testifying before that committee was the NNU, the largest nursing labor union, talking about Ebola and how our healthcare system is not prepared. And I think that there can be some lines and comparisons drawn between what's been done on Ebola and maybe what should be done on some of these other pathogens, such as CRE, which is a highly deadly bacteria that is has a fatality rate of 50% when it gets in the bloodstream. That is very, very worrisome. And maybe we need to also paying attention to those type of organisms, which we have an active problem in.
Marianne, I appreciate your call. Thank you. We have to take a break. Dr. Kevin Cavanaugh is my guest as we talk about Ebola this morning. What about the health workers? We haven't really addressed them yet.
Yeah, that's very interesting, a problem of are the healthcare workers which take care of Ebola patients in the U.S., should they be quarantined for 21 days? There's not a lot of good epidemiological evidence that would support yes, except for the fact that you now have 2 healthcare workers that, of course, got infected taking care of an Ebola patient, and they're having a hard time identifying how they actually got infected, other than they weren't wearing the spacesuits towards the end of life. And there are some hospitals now that I know of, at least one big healthcare system, that's going to start requiring workers that take care of an Ebola patient to stay home for 21 days. Now, that's to stay home. That's a little bit different than what happened to the nurse who came back from Africa, who was thrown into a plastic bubble without amenities and treated as pretty much like a criminal. And so that's a big question. Of course, you think about that. Well, you just don't take care of an Ebola patient and go home. That patient's going to be in the hospital for 10 days. If you're doing a 12-hour shift, does that mean you go into quarantine and come out of quarantine and take care of them again? Do they get another team? It's going to be very, very much staff intense. And of course, as we talked about, you have to be trained, go through specialized, really training to get these suits on and off without contaminating yourself. And so if indeed we do that, you have the luxury of doing it as long as the epidemic is small. If it spreads and we get more and more patients, it will really outstrip our resources to do that sort of a a quarantine. Luckily, this organism, the Ebola, the virus, is not that infectious early on, and being a virus, it doesn't live that long in the environment. I mean, it's not like a bacteria that can live, for weeks and weeks. Ebola, from what I've read, you're talking about a much shorter time period. So that's very positive on making sure that this doesn't get a human-to-human spread in America.
This email came in early this morning because I was promoting that you were going to be on talking about this. So please ask your guest to comment on the certain effect Ebola will have on the cost of Obamacare. I was informed yesterday that the cost of my bare bones health insurance plan will be going up 15%. How much will Ebola care add to our health cost? Any idea?
Well, you have no idea, but that's one of the big concerns of stomping it out in Africa before every person with a flu that comes into the ER, we've got to worry about whether or not they have Ebola, which will outstrip our system. You have to realize that this is not a healthcare system, whether you have socialized medicine, free market medicine. No, this is going to drive up the cost of any type of healthcare system. You can't change your healthcare system and negate the expense of the Ebola. It's going to be around if this gets out of control, and that's one of the main reasons why you need to stamp it out in Africa. And I can't say that more strongly. You do not want to get this endemic in the U.S.
Next time you're back in December, we'll talk about the implications of healthcare in this country as a result of what happens at the polls today. But if after today's polling, and thank you for your frank discussion on Ebola, but at the end here I want to say, if after the polls close today we find that Republicans have taken over the Senate, so now they control both houses of Congress, what, if any, effect is that going to have on health care in this country, in your opinion?
Well, I think initially it's going to be minimal because you really can't do much, even with varying what's going on without controlling the White House. I mean, the laws have been passed. He has veto power. It's not like Kentucky where the veto can be overridden by 50%. And regulations have been written. You don't need to have congressional approval for regulations. There will be able to get something improved because I think both sides of the aisle want to do improvements. But as far as repeal, I just don't think that's in the cards. And that's going to be 2 years from now, whether or not we want to appeal our health care reform and go to something different. And that, I've always said, is what's going to be the huge fight, whether or not at that point we go to a single-payer system or you go to a free market system. As you go up to Washington, neither the right or the left is happy with healthcare system. You have a group who wants single-payer, a group wants to go back to total free market.
We got 30 seconds. Tell us one more time how folks learn more about your conference on Friday.
Go to healthconference.org, and public is welcome, and I think that they will enjoy it.